I'm now going to talk about the AD myths and misperceptions. So the first one is that Alzheimer's disease can be prevented, but as Ronald Tucker Rhodes discussed in her article, Myths and Facts, Alzheimer's disease, this simply is not true. Rhodes' article confirmed that there's currently no way to prevent someone from getting AD, and there's currently no cure for someone with AD. In an article by Cliff Marantz titled Clearing Up Common Myths About Alzheimer's Disease, he talks to Dr. Prepinger, a behavioral neurologist at Novant Health, Neurology and Sleep. And Dr. Prepinger states that there's nothing you can take to help with memory to try hold off developing AD, but he said that exercising for 30 minutes at least 3 times a week could lower the risk of AD. The second one is that symptoms can be reversed. But because AD is a generation of the brain, as author Rhodes stated in her article, sadly cannot be reversed. And the last one is that when someone is diagnosed with AD, their life is over. But per the article titled Alzheimer's Disease, Myths versus Facts, author Krista Hillis stated that it is believed that doing your part in terms of balanced lifestyle could help slow down the progression of this disease, or at least improve selected symptoms. Furthermore, in the article, Making the Right Connection, Maximizing Lexical Impairment in PPA and AD, the authors note that intervention for people with AD have typically applied errorless learning and space retrieval principles, reflecting memory-based approaches to support lexical retrieval.
Hi, my name is Julia, and in our call to action for lexical impairments in primary progressive aphasia and Alzheimer's disease, it is important for SLPs to not define someone by their diagnosis. It is always important to look at someone as a human and that you are there to help them and not rush anything in therapy, and always be there for them and understand where they're coming from. It is important to educate family members and people in the community in order to raise awareness. An Advocacy 101 for the SLP speech is beautiful.org. Raising awareness and education about PPA and AD is educating the community through nonprofit organizations focused on communication disorders. So every day we encounter people who don't understand, especially students that have communication disorders and language deficiencies. And it can be very harsh for students to go through that because a lot of people don't understand and they may get bullied. So this is why it's important to raise this awareness and for the community to understand people who suffer from PPA and AD. So for SLPs that work in schools, they need to advocate for the child on their caseload through an IEP, which is an individualized education plan that can transfer over to the workplace. This is a legal document, and as well as the IDA, that is a law that is required for special services and define the role of SLPs in schools so that they can advocate for this and for students to get help if they have disabilities. On the other hand, on ashawire.org, Sarah Blackstone is a CCC SLP, and she wants to ensure that we can effectively communicate, that patients can effectively communicate with providers and loved ones. A teach back is an effective method designed to ensure that patients understand what a provider is saying by asking them to repeat key points of the instructions. So if the student or client doesn't understand what you are trying to say, it's important to catch those cues, even if they're not verbal, and repeat in a more simple way, but also in an adult manner for them to understand. Also, from journalsage.com, aphasia patients like to go through education and support groups, and it brings them satisfaction of knowing that there's other people like them and that they can feel safe and comfortable to talk about this. They gain mental support of sharing different coping strategies of how they deal with it. And they go to 10 2-hour weekly sessions with language activities and learning communication strategies with others in their same condition. MayoClinic.org, coping and support is losing the ability. It's important to cope and support when you're losing the ability to communicate, because it can be very stressful and frustrating at times, and also for friends and family. So this is when in our article, family was important to come into therapy because the patients were very comfortable with your family members. So it would be easier for anyone to talk to their mom rather than a stranger. And especially with these deficits, it's important to have someone that you feel comfortable with and that you can communicate and tell a story without feeling that you're being judged and you don't really know this person. So that's why it might be easier to have family members in the therapy room just until they get comfortable with you as an SLP, and you let them know that this is a safe space for them to communicate and talk to you about whatever they're feeling and be able to say things that they want to say. So it's important to listen and be transparent. And in class, when we watched that video of the older man who had aphasia, you saw that the SLP was very patient and he was using gestures because he knew what he was trying to say. So it's important to give them time and space and be patient for them to get out what they're trying to say, because in their minds, they know what they want to say, but sometimes it can be a little bit difficult for them to form those sentences. Medicalnewstoday.com says that it's important for people with Alzheimer's to create a routine that is simple for them to follow on an everyday basis. So as an SLP, this would be great for you to have a specific therapy session that you do with them every time that's the same or a little bit different, just so that they can feel comfortable doing this. Overall, through lexical retrieval, SLPs also use picture cues, and it's important to not be biased in this, as if you were showing a student who doesn't know what Christmas is because they are Jewish, they would not be able to tell you what a Christmas tree is. So it's important to not use any bias, lexical cues, or anything like that. I hope that we can all come together and raise awareness for PPA and AD. Thank you.